My name is Tim Porea. I'm a professor of pediatrics here at Baylor College of Medicine and a pediatric-hematologist-oncologist at Texas Children's Hospital. So I was a student at Baylor College of Medicine on a Navy scholarship. They funded medical school for me. After medical school, I went back to the Navy and did my general pediatric residency in San Diego, California. After San Diego was 2 years in Okinawa, Japan as a general pediatrician taking care of military-dependent children over there. Following my time in Japan, the Navy funded me for my pediatric hemonc fellowship, and I was able to come back to Baylor for that. Spent 3 years here in my fellowship, and following fellowship, back to the Navy. For my final 14 years with them, I was in Southeastern Virginia and Portsmouth, Virginia as a pediatric hematologist-oncologist, then again taking care of military families there. When I retired from the Navy in 2014, I came back here to Baylor for my third stint and my current position at Texas Children's. My choice of the Navy was a pretty easy one given my family history. I can go back to my great-grandfather on my mother's side of the family. He was served on a submarine in World War I and was killed in World War I. He had a destroyer named after him. At the time, back in 1919, had a movie theater at Pearl Harbor at the submarine base named after him that's still standing to this day. And my grandfather on her side, who served in World War II in the Navy, and my father's service. So between the three of them, in my family, nobody else had been career before myself, but it was pretty natural for me to just look at that branch of the service. The only thing I ever wanted to be was a doctor. I'm one of those guys that, as long as I can remember, joining the Navy, initially, the big draw is the scholarship. There's no way around that. Once I actually got in and was serving and saw the quality and the caliber of the people I was working with and the patients, and in my case as a pediatrician, the families I was working for, kept me in well past my obligated time for all the training that the Navy had funded. I stayed a total of 10 years beyond what I needed to. I think one surprise that most people have is that military medicine is an awful lot like civilian medicine. In the end, we're all taking care of patients and there to do right by them, whether we're physicians, nurses, pharmacists, what have you. And so the day-to-day practice is not very different in a military hospital than in a civilian hospital. The main difference really is that we're all wearing the same clothes. As a general pediatrician, when I was in Japan, you're really out there kind of by yourself. We had 5 Navy general pediatricians there, and there was a neonatal intensive care unit, but there were no other subspecialists there. So when we send young physicians overseas in the military, they really have to be prepared to function independent of having 911 to call if something goes wrong. If I had a super sick patient, me and my partners, where we were in Okinawa, if we had to get them to a higher level of care, that was a flight to Honolulu, which was 10 or 12 hours by air, and nobody comes in the plane like an ambulance crew to pick them up. We had to get on the plane and be prepared to support the patient for those hours over the Pacific. So here in Sugar Land, you don't have to do that. You can call 911 and a very sick patient can be out of your office, in a quick amount of time. Lessons that the Navy taught me, I think, are the importance of teamwork. Nobody can do medicine alone. For sure, as somebody who focuses on pediatric oncology, I can't do that by myself. You need to be able to work together as a team, diverse interests and diverse specialties and supportive personnel to be able to reach that final mission of taking care of that patient, curing that patient of their cancer in my case. Part of teamwork is respecting everybody on the team, right? And no matter who they are, no matter what their role is, their voice is important and needs to be heard. I learned that in the military, but it definitely crosses over into the civilian world. I miss being in the military all the time. I try to keep involved. When I came back after my Navy retirement, I reached out to the Office of Student Affairs here and gave them my background information and told them what I could offer to the scholarship students who are here at Baylor now. When you're out at a civilian school on a military scholarship, especially in a town like Houston that is not a military town, there's not a lot of guidance for you in terms of how do you be a naval officer, how do you prepare for your Navy internship or for the applications for your Army or Air Force internships. In my day when I was a student here, the only way I learned how to navigate that whole process was there were 3 guys in the Navy the year ahead of me. I didn't want current students to have to go through all that I went through. I wanted to be able to give them a resource to get all their questions answered in a reliable way and not be finding things on the internet that, as we know, may or may not be fully accurate. Started out working with just the Baylor College of Medicine medical students. In the last since I've been back 14 years, that's expanded to all 4 medical schools in Houston. So I work with them to get them ready for applying for their military internships, no matter what specialty they're interested, whether it's pediatrics or something else. I still have a lot of contacts within the military that I can find them somebody in their field of interest, no matter what it is, and no matter what branch of service they're interested in. When we started doing the commissioning ceremonies here for the military medical students in the last 14 years, I was very appreciative of Dr. Hoffman and the administration for supporting that when I asked to do that. I think it's very important to be able to recognize the military students. Everybody who's graduating, it's a very momentous time in their life, but these military students are committing to 2 different professions now as they graduate, and I really wanted to be able to honor them and celebrate them with their families in some way, and to be able to do it again here in front of Dr. DeBakey's uniform is a really great place to do it. For the veteran community, veterans who are doctors here now, thank you for continuing to do what you do. I appreciate all of you who are here in the medical center or outside the medical center, wherever you're serving, and continuing that very important mission that we have for taking care of each other, whether it's adult patients, pediatric patients, the families that we as pediatricians help take care of. So I appreciate all the veterans who are here.